Thank you for joining us. My name is Scott Kennedy, and I'm the Director of Marketing and Corporate Communications at Connexall. Our frontline workers provide essential services to the healthcare facilities and can represent up to 50% of the healthcare workforce. This includes direct care, such as nurses, doctors, dentists, pharmacists, technology, environmental, and administrative services. They provide the very foundation to ensure that patients and residents receive the highest quality of care. Since the outbreak of COVID-19, our frontline workers across the globe have been pushed to their limits. Their resiliency continues to be tested. Many have been infected by the very disease that they're protecting us from. In the United States, New York has the highest number of COVID cases and confirmed COVID-19 deaths. The mental health of these frontline workers have been challenged, yet they continue to go back to work and provide hope to our communities. They are heroes. Today's guests join us from New York as we discuss the impacts of mental health and frontline workers in COVID-19. Crystal Kim is a certified psychiatric nurse practitioner dedicated to helping people who are suffering mentally and emotionally. She received her master's in nursing psychiatry from Columbia University and her bachelor's in nursing from the University of Pennsylvania. Crystal is trained in psychodynamic, cognitive behavioral, and supportive therapies. She has over 12 years of extensive experience in evaluating and treating adults in emergency room, inpatient, and clinic. Alexis also joins us from New York, previously of Memorial Sloan Kettering Cancer Center, and is our clinical workflow manager at Connexall. She has over 10 years of experience skilled in inpatient acute critical care and surgical ambulatory services. Alexis received a master's in nursing informatics from the New York University. Crystal, Alexis, thank you very much for joining us. First question over to Crystal. In your experience, what are some of the challenges facing the frontline workers today?
Our frontline workers have really experienced an emotional and psychological roller coaster since early March when this pandemic was first emerging. They've had to put their own anxieties aside, adjust to the tremendous influx of high acuity patients, and deal with this pandemic head on. Now that things are slowing down and frontline workers have a chance to catch their breath, they're starting to finally process the trauma they've experienced as almost a delayed reaction.
Okay. And with the rapid spread of COVID-19, what are the psychological impacts to frontline workers?
The majority of frontline workers are working in hospitals, and the hospital is typically a very systematic environment. Everyone knows their role, which unit they're working in, what their responsibilities are, what the protocols are that they should follow. And with the onset of this virus, all of that went out the window. And the biggest psychological impact that I'm hearing from frontline workers is surprisingly not about the trauma they're witnessing left and right, although that is a close second. It's about the high anxiety of not knowing where they're going to be deployed to, suddenly having ICU patients on ventilators, not knowing what the protocol is because this is a new virus. They're feeling an overwhelming loss of control on a daily basis.
And what are the long-term implications of these impacts?
Most frontline workers have experienced or are experiencing burnout. That is an emotional, physical, and mental exhaustion after a long-term period of stress. This loss of control and helplessness that we talked about during a disaster is the main ingredient for PTSD, post-traumatic stress disorder, which is characterized as feeling highly anxious and depressed after a disaster is over.
Thank you. Alexis, is this similar to what you're seeing amongst your nursing colleagues and customers?
Yes, absolutely. Everything that Crystal described when we talk about psychological impacts or the challenges or even long-term implications, if we look at it from a nursing informatics perspective, a lot of those informaticists during this time, at least with the peak of COVID, they were thrusted into positions that they may not have done in a number of years. Simultaneously, other nurses who may not have had ICU experience or even at least some training was just under a short period of time. So that anxiety when it came to treating COVID patients or even nurses who were put into other departments to treat these COVID patients, that yielded a lot of anxiety for them. And I know that for our company as well, it's, what do we do to help mitigate that internally to support our staff?
Thank you. Crystal, you mentioned frontline frontline worker burnout. Have we reached a peak when it comes to frontline worker burnout?
For now, yes, we've passed the peak in at least New York City because the number of new cases are in decline, and so the acute burnout phase is over. It's important that frontline workers who couldn't seek help before do so now and process what happened.
Okay. And with the discussion around a second wave, and if a second wave may actually come, if we can't flatten the curve through social distancing and other measures, what type of resources are available to help the frontline workers cope with this current pandemic?
Different hospitals have thought of different ways to help their staff members. Some hospitals have support groups, both in person or virtual. Some have hotlines to text or call when people are feeling overwhelmed at work, meditation rooms to rest quietly. We've even heard of individual counseling sessions conducted by members of the psychiatric department directly on the inpatient floors in order to be very accessible to staff. And so I think these are all really thoughtful and helpful resources. And then there are also practical resources like free food, parking, hotel stays near the hospital to reduce commuting. Those are also always helpful.
Alexis, from a service perspective, how is Connexall currently helping frontline workers through these challenges?
So for Connexall, communication is the key to help our frontline workers. We've surfaced unit views for clients of ours to show where are these COVID patients, how are they moving through their ecosystem, and conversely, how do we provide virtual rounding for the frontline staff so that they help protect themselves, help protect their patients, minimize the use of PPEs. But I also like to highlight the things that we're doing for our staff at Connexall. We provide weekly yoga sessions. We have weekly sessions where our staff can, talk about the positive and the good things that are happening right now while this pandemic is happening, whether it's the introduction and birth of a new family member, people graduating, music sessions, all of those are great things that we're doing alongside motivational speakers just so that our staff have an avenue to speak about their feelings of what's happening during this time.
Yeah, it's so important to have that connected community. And Crystal, how can we help those frontline workers maintain that necessary resiliency and protect their mental health if that second wave does come?
I think preparation is key. We need to assume that the second wave is coming and use our experience from the first round to analyze what worked and what didn't work. Hospitals should develop strategies for the second wave and share that with their staff so that we can all be prepared for what to expect. Because like we talked about, the daily anxiety about the unknown was one of the biggest psychological challenges for frontline workers. Preparation, whether it's sharing a plan of who's going where, or having staff receive additional ICU training while they aren't overwhelmed, will really help relieve anxiety, allow staff to feel more confident and skilled, and also make it easier to anticipate the second wave.
Thank you. Final question over to Alexis. The World Health Organization named 2020 the year of the nurse, the year of the midwife. What does the phrase, once a nurse, always a nurse, mean to you?
I love that phrase, once a nurse, always a nurse. And, Crystal and I are clear examples of that. A lot of times when you think of nursing, you think of frontline staff, but there are many avenues to nursing that are represented by that phrase. And even the nurses who are now retired, exhibited by this pandemic have come back to help. And so nursing goes across all spectrums of community care. They are in other companies other than hospitals. So, I love that phrase, once a nurse, always a nurse.
Crystal, Alexis, thank you very much for your insight. And to all the frontline staff around the world, thank you. Your courage and your humanity brings us hope. Hope that'll get us through this. At Connexall, we're committed to helping you on your journey of hope. Thank you.